Hello, this is Joe Yuhan here to talk to you guys about some advanced and alternative strategies for soft tissue mobilization, specific in this case to the lower leg. And so lower leg and foot take a lot of stress when we run. They are responsible for doing so many different movements and holding us upright when we land on the ground and pass over it. And so lots of force goes through this tissue, and it very frequently gets stiff. And so the conventional strategies for soft tissue mobilization tends to be compression, right? It's like, I've got stiffness in my calf, so I'm going to massage that, or I'm going to foam roll it. Or I have stiffness in my foot, and I'm going to take my foot and just smash it on a ball. These sorts of strategies can be effective in some respects, but to have a little bit more of a nuanced understanding of the different tissues in our body, and specific in our lower leg and foot, can help us be a little bit more nuanced and more effective in how we get that tissue moving. And so the first thing I'm going to talk about is thin layers of fascia. And so fascia is this connective tissue that covers everything. It's like almost like a shrink wrap, or like a sausage casing that goes around all of the muscles, but also connects one muscle group to another muscle group and muscles to bones. And that fascia, even though it needs to be strong, can sometimes get too tight. And so when we're dealing with, say, foot pain, we tend to get obsessed about what's happening with the plantar fascia. And so, yes, we can roll that plantar fascia, and we can also, and should, massage and roll the tissues of the calf and the posterior leg. But there's layers of fascia that sort of interconnect the foot and the ankle that need to have some mobility. And it's not just on the bottom of the foot or the back of the calf. There are actual tissues on the outside of the ankle and the inside of the ankle that deserve some of our attention. And so there are a couple specific fascial areas that we should really consider if we have aches and pains in the ankle, in the heel, in the foot, or even up into the calf. And so the first strategy that I'd like to talk about is to work on the inside of the foot and the ankle. And there's a couple places where that's important. Number one is this spot right here. And so this spot, that is the medial heel. And the medial heel houses a bunch of important structures. You have 3 tendons here that go from the lower leg, course their way underneath here, and go into the foot. Along with that, we have a couple blood vessels and the tibial nerve. And so if that tissue gets tight, we can have all sorts of issues related to those muscles and tendons up here, but also even the tibial nerve as it comes through. And so that's not very thick tissue, and we don't really think of it as something that needs massaging, but it does, and it's important that it has movement. The same thing, there are a couple fascial points on the inside of the foot, sort of at the midfoot and at the big toe, same thing. They're the beginning of a fascial line that goes all the way up the leg and into the body. And that line, if that becomes stiff, it can really cause a functional mobility loss in the rest of the foot. And so what do we do with points like that? What you want to do is apply a consistent mobilization force into that area using something. And that something can be a ball. It can also be your own thumb, or it can be an external tool. And this is something that the Institute of Physical Art, where I'm studying right now, developed this tool. And it's just a piece of wood that really almost acts like a stronger finger. But whatever you choose, what you want to do is to get on those specific tissues, and whether it is the ball getting in on the inner ankle as such, or your thumb, or in this case the fascia freer, what you want to do is to get in on there and work this specific tissue is called the medial retinaculum of the ankle, and just work that. Very often it feels better if you can put a little bit of lubricant. Coconut oil works really nice, and you just want to work that. And more than just 10 or 20 seconds, you want to work that for a few minutes. And what that does is it develops heat that tends to sort of melt away some of these restrictions. So you've got the retinaculum point here, and then you have these medial foot and ankle points here. The same thing applies for the lateral ankle. And so we have a couple points similar on the lateral side. You have a lateral retinaculum tissue here on that heel, and then you have some fascial points on the outside of the foot as well. So same thing, working those points either by rolling on a ball, using your thumb or some other external tool to get in and do prolonged force to those points. And you'll be surprised at how sore they can be. But those are the thin fascial points. And again, the take-home point here is that even though it doesn't seem like there's a lot of meat on the outside or the inside, this is important tissue because it envelops everything. It envelops and connects the plantar fascia. It connects the calf. And so restoring motion, even at these little links in the chain, can make a significant improvement or effect on the whole system.